Hi, I'm Dr. Jim Parry. I am a double board certified facial plastic surgeon and fellowship trained facial plastic surgeon who specializes in all surgeries and non-surgical techniques on the face. Today we want to talk about a fairly new technology. It's called Embrace RF, or otherwise known as Facetite. Embrace RF will allow us to get very similar results to a facelift. However, we don't have to use a scalpel or make any incisions. How the Embrace RF works, or Facetite, is we make 3 little entry points using a small needle right underneath the ears and under the chin. This allows us our access to put the probe in. How the technology works is we put a probe underneath the skin and we deliver radio frequency energy. The radio frequency energy is going to cause a controlled thermal injury, which is going to cause the skin to remodel and to retighten. Also, in addition, the radio frequency will, if there's any excess fat in the face or the neck, it will also destroy that fat. So once it's healed, you'll have a similar result to a facelift. Now, unlike a facelift where we can see the results right off the bat, with Embrace RF or Facetite, it's going to take about 4 to 6 months to get the full results. You will leave the office within a week or two and you'll see results, but you won't see the full results for 4 to 6 months. The nice thing about Facetite is it doesn't require any scalpels, doesn't require a lot of downtime. It's done right in the office under a little bit of sedation, no need to go to the operating room, and it's about 1/3 the cost of a facelift, and will give you about 40 to 50% of the results of a facelift. So this will be the room that will be performing the procedure today, the Facetite or Embrace RF. The machine is right over here, as you can see. We will show you a little bit later the hand pieces and how they plug in and how we use them. Some of the instruments we'll be using, we'll just be using a couple little cannulas to go ahead and inject the fluid that's required, and I'll talk about that later. We want our rooms to look very homely and inviting to the patient. We got a beautiful view out here for the patient as well. I will be assisted today by Michelle, who's a licensed esthetician as well as a certified medical. So as you can see, the patient is a little swollen from the procedure, but all that swelling will go away over the next few days. She's red from the Morpheus, and that redness will also fade away. Probably by tomorrow, most of that redness will be gone. We're just putting a little bit of Neosporin at the 3 little entry points that we made. And next we're going to put a compression dressing on. This is going to hold pressure, which is going to help get that swelling out faster, and it's also going to help prevent any what's called a hematoma. So we're all finished with the case. As you can see from watching, it's minimally invasive, just 3 little insertion points. A patient tolerated extremely well. She never really had any type of pain or discomfort. This is a great procedure. We're going to slowly over the next 4 to 6 months see all the changes that take place. When she comes back in as little as 1 month, we're going to see noticeable changes. We're going to see a tighter jawline, tighter neckline, any little bit of fat there should be gone, and see a little bit of lessening of these lines right here on the face. We offer complimentary consults. If you're interested in this procedure, you can call our office and we'll get you on the schedule, and you can see me, and we can determine what's the best approach for you. We can also follow us on Facebook and Instagram, and like us if you would. Thank you.